My name is Shane Meadows. I am the co-founder and co-executive director of Advantage Lancaster, a nonprofit for young people trying to help them seek higher education opportunities or post-secondary opportunities. The past year and a half, the COVID-19 epidemic has affected our organization specifically in just ways in which we mentor and connect with young people. It is very hard, extremely hard, to make connections with young people through Zoom. And so I would say probably the hardest thing to do through this epidemic is creating new relationships, building on bonds that we had in the past, just being able to touch your students, give them a hug or a high five, or just sharing meaningful experiences in person. And so we lost out on 18 months or 19 months of being able to share each other's stories, give each other hugs, laugh, smile, and basically have in-person programming. Advantage Lancaster's relationship with Dr. Hamlin is a personal relationship first. So Sharice and I, we are both founders of nonprofits that are run by African American and founded by African American people. So we connect at a certain level through that. So we talk to each other about advice on how can we collaborate, or even, what are some pitfalls in the nonprofit world that we should be aware of, or what are some grant opportunities that we should be aware of. There'll be opportunities for Advantage Lancaster students to work for Patients Are Waiting. So as an educator for 20-some plus years, I work with children. I'm a 6th grade teacher as well as a nonprofit co-founder. So I thought it was really important for me, as far as me being safe and being in the classroom with students, as well as my mom is in her 70s. I just lost my dad, and I just felt like I wanted to hug my mom. And like I said on a Zoom call, you can't hug your mom on a Zoom call. You can't wipe away tears on a Zoom call. And so I knew as soon as I got the opportunity to get vaccinated, I was going to do so because I wanted to be safe for my family, for the students that I taught, but on a personal level for my mother. I wanted to be able to be with my family, and it was a no-brainer for me in that aspect. As far as the pandemic affecting communities of color, anytime you have extreme situations like a pandemic, not like we have these all the time, but it's always going to affect communities of colors or those underrepresented in life even more than other communities. And so I would read in the paper or see on the news the numbers and the disproportionate rates of how it was affecting people of color. And so I thought it was very important for me to do my part in making sure that I was safe and making sure the people in my family could be safe. I just thought it was just really important for people of color to take it seriously. I'm very optimistic when I look at what Patients Are Waiting is doing. I mean, they're mobilizing. I mean, every weekend you see them offering the vaccine to people. And I'm not sure what the turnout is, but they're not stopping. And so that gives me hope that, there are people out there that are continuing to fight and, get that message out that the virus is real. And if you want to be safe, this is an option for you. So I'm very optimistic as far as I do know that there are healthcare workers and there are people that are, still fighting the fight as far as making sure that the right information and the vaccine is getting out to people who may be reluctant, who may have some hesitancy.
And one. Hello, folks.
Hello.
Hello, good afternoon, and welcome to week 4 of the Health Equity Music Festival.
Yes. Music and medicine.
Yes, music and medicine.
Yes.
We are the TCP Network, better known as TCP in the morning.
What up, though?
But
Yes.
good
How y'all doing?
evening.
Yes.
Good evening. Happy Friday.
Happy Friday. This is week 4, like we said.
Yeah.
We've
So,
been.
You know what? Fun fact, if you got your first dose during the first week, you should be back here.
Yep.
This week.
Yep. It's time to run it back.
Yep. Run it
Time
back.
to run it back.
Week
Or-
4.
Or if you haven't gotten one yet, you can come in and get one
Pull up.
today and then get it
Pull up.
the last week.
Exactly.
So, yeah,
What you
come
waiting
on
for?
through.
Right.
It's not
right.
too late. First or second shot, come on by.
Yes.
Yeah,
Yes.
You've been watching for 3 weeks.
Yeah.
All right, if you ain't been down there, you've been watching for 3 weeks.
Enjoying it.
Like, come down.
You
Matter of fact,
dig.
come talk to one of our
Right.
black lady doctors. Come ask
Absolutely.
some questions. If you're scared, they're on the fence
Right.
about getting vaccinated or even getting your booster.
And
All right.
and I mean, there's the services down here as well, man.
Oh, man.
Yeah.
man.
Listen, Cap's here again.
Yeah, yeah.
And they're still helping people out with their rent, their light, and
Yeah.
gas bills.
Yep.
Water bill as well, you know.
Yeah.
Also, Boost Mobile's here as well. You know what they're doing.
Get yourself a tablet.
Giving out free tablets.
Yeah, man.
Free. You
Free
know
tablets.
what? You know what? I remember as a kid they used to say there's no such thing as a free lunch.
Ten Stoffel. Ten Stoffel. That's what we learned in economics class. Ten Stoffel. There's no such thing as a free lunch. Yeah.
Not at all.
So is this tablet really free?
No. I believe it's really free. I just think that we were capitalismized.
I hope is everybody getting ready for this nor'eastern?
What are you talking about?
I'm sorry, I just went way off board.
Yo.
But there's a nor'eastern coming. We can't
No,
ignore it.
When?
I made plans. I got stuff to do.
I feel like every storm that comes now is a nor'easter.
Yo, yeah.
It's a nor'easter.
No,
Yeah.
that's
That's
not
a
how-
nor'easter.
that's not
Run for the
how it
hills.
works.
No?
No, they come off the coast and they blend in with like a southern storm front and a northern front. They come in together and they clash and it's like going up the coast. And
I mean,
it's a lot of stuff going on with it, but yeah, nah.
My kids are in Boston. My kids went to Boston today.
oh,
In Boston, so they're about to be all
Stuck.
the way
Oh
snowed.
yeah, no, they
They're
so
about
good
to
for real, for real.
See you guys in March.
you did that on purpose.
We don't
You
live
did that-
nowhere near Boston.
Who sends their kids to Boston in February?
Right, it was raining outside
All
today.
right, listen. We co-parent. All right, it was their mother's decision.
Oh.
Not blaming her,
Hey, well,
but have fun in the snow.
yeah. Also, she's in Boston now.
Yeah, they're up in Boston just for the weekend.
that's
Oh,
awesome.
man.
For the weekend.
For the weekend. That is nice. That is nice. Well, shout
Well,
out to
nice
them.
snow-thin weekend.
I hope they brought their boots and shovels.
I hope the internet's working.
They're gonna be stuck inside.
Yo, actually, that's the thing. You know, boom, news story. For the last 48 hours, Comcast has been going through internet outage.
Uh-oh.
So like if you are one of those people that like halftime pay your bill on Comcast and you only pay it when your stuff gets shut off, like it ain't that time, boss. It ain't that time.
They're just gonna leave you alone.
Oh, it's not me, it's them.
Right.
Okay.
It's
That's
not
good to
you. It's not
That's good to
you.
know.
It's them. You still got that 2-week grace period that you usually take. So go ahead and take it, player. it's not
Play
you.
on play. Here we go again.
Yes.
It feels good to be back. I feel like I'm getting to know everybody here.
Yes.
You know, I'm
Right,
seeing all these
right.
familiar faces. Like,
Right,
I've
we
seen
got-
you guys here before.
I see Dr. Livingston here.
You know what? I was about to
see
put
Sam
Dr.
here.
Livingston on Front Street and say I didn't get to really, talk to her during this time. So I would
really?
love an interview.
I'm thinking about when we did interview her, you know?
Yes. Oh, have you seen the commercials?
Oh, I did.
First of all, I only see the commercials on ESPN. Yo, straight up,
see?
I'm like, yo, I know her.
National stage. National stage.
Right.
We gonna bring Dr. Livingston in here.
Excited. I was like, did I just see Dr. Livingston after PTI? Like, yes, I did.
Yes.
Yes, I did. Look at that. Yep.
I was say that's how we say big league.
Right. Big league. So hey, folks.
Get on down if you have
Yes.
not been vaccinated.
Yes.
Or if you need your booster, come on down. We're down here at the Health Equity Music Fest.
You dig.
Sponsored by Patients Are Waiting.
Yes.
right.
So
Yeah, like
We got one of our black lady doctors.
yes.
Here,
I'm so
here.
excited.
So, thank you for coming on.
Yes, I'm glad to be here.
Welcome, Dr. Livingston. You know, I feel like I haven't sat and talked to you on a show since we were doing vaccinations at Clipper Stadium.
Oh my goodness, yeah, it's been a bit.
Right.
But I'm glad to be sitting next to you, Lady L.
Oh my goodness. Hey,
See?
I pay don't.
Attention.
But you know, we're friends in real life, so we can just be us. But you know what though? Speaking of Clipper Stadium, you guys have been at this for a while.
Yeah, we actually started vaccinating at the beginning of the summer. It was May. I remember the day specifically. And we said, you know what? It is time to bring vaccines to the community. We have to create an initiative where we're coming out and meeting people where they're at. So every weekend throughout the entire summer, every Saturday and Sunday, we came out and we had our street team and we vaccinated, and that initiative went so well that we said, you know what, we can't stop. Things are moving, things are rolling, let's keep going, and we created this Lancaster Health Equity Initiative.
Wow, wow. I love the name. I love the name. So why equity? Why Health Equity Music Festival?
So part of why we created the Health Equity Music Festival is we know that our people just love music. Music brings people together. It makes people feel good. And so the whole purpose is, what is it that we can do to make the environment welcoming? And when you talk about health equity, you think about what are some of the barriers that are keeping people from gaining excellent health? And it's transportation, it's lack of access to affordable health care, food insecurities. So the goal when you talk about health equities is to eliminate those barriers, destroy them, dismantle them. And you can do it one step at a time by being strategic and addressing each of those, but doing more than addressing, creating actionable outcomes.
That's awesome. That is so awesome. So, in some of your initiatives, you're actually like at the beginning of one right now with the Pipeline of Dreams.
Pipeline Dreams. Oh my goodness, yeah. So our Pipeline Dreams program is in its third year. It's a high school program, and the goal of the Pipeline Dreams program is to really create an influx of young learners who are interested in health-adjacent careers. So we focus on providing health disparities research for 11th graders, 12th graders, and right now, this past Tuesday, Dr. Hamblin and I sat down with our team and we hosted, I think it was like 37 or 38 high school students from all over, and we really focused in on what is it that you need to do to become a health specialist or a health profession, and we just like breathe life into, pour gasoline on their dreams.
Yes.
And it's a 12-week program, so we're running every Tuesday from 6 p.m. to 8 p.m. For the next 12 Tuesdays, and we're really just going to give the students what they need to really become the health professionals that they desire to be.
Oh, that's so exciting. And you said that it's in its third year. Have you seen any students repeat the program, like any juniors come back their senior year?
So the good thing is we want to give every student an opportunity, so we create this sort of rolling, rotating process.
Okay.
We have alumni of the program who have gone on to get, some really good internships and really good research projects with highly respectable staff in our area and beyond.
Oh, wow. That is awesome.
Yeah, we're really proud of our students.
Oh, my goodness. And you know what else, though? You guys outside of like your younger students, your medical students, and helping them, mentoring them, I remember being on a call, and there were like all of these young black women, and all of them were talking about all the medical school acceptance letters that they got.
Yes, and so what we do is we really continue the relationships that we have with our medical students, so that once they're in medical school, we want to see them be successful in that arena. So it's not just about, increasing the pipeline, it's about making them successful while they're on the pipeline. And so we create programs like our diversity conference that we have September of every year, so that we can bring our medical students back, connect with them all throughout the year. Actually, we're going down to Orlando, Florida. Patients Are Waiting will be in Disney World. Yay! We're heading down to Orlando, Florida for the SNMA conference, the Student National Medical Association conference, and we will be having an amazing time down there. We're going to work with our students to show them about networking, building relationships, and really just having a good time and connecting. So we're looking forward to that. That's in April of 2021. Patients Are Waiting is coming to Florida.
Yes. How about it?
Yay.
How about it? So you guys have been doing this since the pandemic has started. You guys done Clipper Stadium. You guys are here now. Where were you guys at before that? I feel like I'm forgetting.
Brightside.
Yeah, you guys are at Brightside. So you guys have been around like.
The Mix,
Yeah.
Brightside. We've been at UPMC, LGH. So we really try to massage the relationships with the local bigger organizations so that we can continue to build that foundation.
Well, the consistency that you guys have, like it's showing and it's appreciated. Like like a lot of people can put events together, they can put programs together, but to have the consistency, you know what I mean, to keep coming back, keep doing it. Like, you know what I mean? Don't just stop after one time or two times.
Well, one of the things that Patients Are Waiting has mastered is the art of reverse engineering. You look at what you want your final product to be, and you create logistics, consistent logistics, so that each time we have a project, we don't have to reinvent it. We say, okay, this is the model that we want. This is what Patients Are Waiting wants to represent to the community. And then we create that and almost make it duplicative so that it's easy to reproduce, whether we're vaccinating, whether we're working with students, whether we're working with doulas, midwives, and just really trying to create a reverse engineering model so that we're successful. And it's really working because our name's out there, but it's more than just getting our name out there. It's building relationships, solid relationships, so that we can be the successful entity that we want to be.
Awesome.
Okay, yeah.
And that's how you've been able to make it all over these different places around the city. Go ahead, Sarge.
I'm curious. I can't wait till we get past the COVID point. All right, to see what kind of events that you guys are going to throw then. See what events come next.
How do you keep the community engagement without the pandemic?
Hey, after COVID, we're going global. You're going to see Patients Are Waiting, in five countries. Actually, speaking of that, at our Diversity in Medicine conference, we host students from other countries. We were present because of the virtual nature of the conference. We were able to bring in students virtually, of course, from 5 countries. So our goal is to continue our global impact so that we can make Black and brown doctors, nurses, Black and brown anything.
It's exciting. It's exciting. It's like it gives us like a reason to be hopeful about the future. Because we're no longer just sitting around talking about change. We're really doing it, inspiring change. Like the Pipeline to Dreams program, like that program right there is going to be big. I feel like it's going to have a huge impact in the future of the medical field.
Yeah, that's our heartbeat. So the heartbeat of Patients Are Waiting is our students. The Pipeline Dreams program is exactly what makes us who we are, and then we build on that by having other existential initiatives.
I love it, and I can see it growing because Patients Are Waiting. Some of your initiatives are so large. So the diversity, the conference, but also the doula initiative, right?
Oh my goodness.
So it's almost like I can see young people matriculate, right? So they come in through Pipeline Dreams, and then they matriculate and they do the doula program, and then they, get accepted into medical school, and then they, get their license, and they can, still have your mentorship and support as they go through what happens.
What you just described is it's the essence of a pipeline. We're gonna bring you in and fix all the potholes that would lead to you falling off of the pipeline and follow whatever path you want, be it doctor, nurses, doula, midwife, anything. One of the things about our doula program is, when you say, where does DDI, the Diversifying Doula Initiative, and shout out to all of our doulas out there, where does that fit into Patients Are Waiting? It beautifully fits in because what we're trying to do is diversify the perinatal workforce. And what's going to improve maternal outcomes is creating this perinatal workforce so that when pregnant women come in, not only do they receive care from a great doctor, but they're receiving care from a great midwife, a great doula, a great nurse, a great medical assistant. Shout out to my medical assistants out there. There are more of them than us, and we have to really breathe life into their careers and their objectives.
Wow. Ooh, they're shining some light. I'm sorry. Go ahead, Sarge.
It's going to be great to see the increase in numbers, because for so long the number's been so low when it comes to doctors of color.
Yeah.
Even when it comes to women doctors of color, the number gets lower still. So we're trying to have that change, that positive impact, where it's not like a once in a lifetime thing. Oh, well, I had 2 Black doctors. Oh my goodness. Can I believe I had that? Yeah. No, it's no longer like that anymore.
Exactly. So. And if you think about the United States physicians and surgeons, only 5% of them are Black. That's messed up. We make up 12% of the population, but yet only 5% of Black doctors and surgeons. This program here, our organization, is devoted to fixing that, because it should be comparable, right? 12% of the population, 12% of the doctors.
Right.
So that's our investment.
That is
All right.
awesome.
Shit,
That
well,
is
thank you
awesome.
for taking the time to
Yes.
sit down and talk with us.
Yes, and I'm
We
so
appreciate
I
it.
love
glad.
TCP, you know, keep it straight, keep it real.
We love you guys too.
Yes. And I'm so excited because I have a little one right now. She wants to be a scientist. And I'm
All
like,
right.
oh, so you want to be a
Okay.
doctor? And she's
What?
like, no, I want to be a scientist. And I'm just like,
That's right.
all
Yeah,
right, we'll get there.
Hey, she may be the next person to invent the vaccine that, you know,
All right.
Right.
eliminates, you know, the next pandemic. You
Right.
know, who knows?
Right, yep. So, and we got to have those people in our community, which I feel so fortunate and blessed to do, like to be able to like have my girls, because you have daughters too.
I do, who are
And-
here too, helping to volunteer. And, you know, it's good for them to see all of this,
Right,
right?
exactly.
And be here amongst us, volunteering, contributing. That's the important part. Your children are here, my children, so that they can watch us in action.
Yep, that is phenomenal. All right, guys, listen. So go ahead, visit the website, patiencearewaiting.com. That's patience, the letter R, waiting.com. Get the details. Listen, learn how they are eliminating health disparities by increasing diversity in medicine. I'm so excited. I'm so excited. All right, well, thank you,
Thank you,
Dr.
Dr.
Livingston,
All right,
for joining
thank
us.
you.
All right. So up next, we got another guest here, Mr. Sammy, who is like our. He has been like coordinating these things, these music equity. He's like the main coordinator. He's the touch point for this. If you need something at this event, you better go find Sammy. Don't look
What's
for
up,
Dr.
everyone?
Nobody. Find Sammy.
It's a great feeling. How y'all doing today?
Text him, Facebook him, get him.
Yeah.
I'm good. And look, I said it when I first got here. I was like, oh my goodness, so nice to see your face. As soon as I got here, I was like, oh man. But you know, it's crazy because just through the weeks, I know. I remember one time we were on the phone and it was like 1 o'clock in the afternoon, and you were like, yeah, I'm on my way to Crispus Attucks to start getting set up. And I'm like, we don't start for 5 hours, bro.
Yeah.
So yeah,
It's
how's it
been
been?
It's been an experience, let me tell you. Like it's so fulfilling to be able to see all of this come together. You know, like when we started off, like me and Dr. Hamblin were just kind of just tossing ideas about a music festival and things like that. And then we saw when vaccinations were approved for ages 5 and up back in October, when we looked at the numbers in December, less than 3% of children were fully vaccinated in the entire county. So we felt it was our due diligence to be able to put on a clinic so that we can get children and people vaccinated.
Awesome.
And so far we've, vaccinated about 45 people. About 16 of them have been first dosers. So I'm extremely excited for the turnout.
Awesome.
I'm curious. All right, let's go back to when planning first began for this. All right, so now we're in week 4. Can you give us a little bit of
Over the
insight
hump.
into the process what was the beginning? Where was the end goal when you first started?
Well, I mean, of course, the end goal was to show that we can have fun in a safe way. You know, music heals the soul, so to put music and medicine together just seems natural, and to be honest as well, we find that our marginalized communities have so much trouble getting accessibility to resources. And you go to so many programs where you just get a pamphlet and they tell you, hey, go to this website, go call this person, go call that person. And you lose so many people in transition from that table to wherever you tell them to go. And so we were hoping with this event that we have SNAP, LIHEAP, and things like that here, and people sign up here so that they know that they're leaving with at least something accomplished.
Yeah.
They make us jump through hoops in order to fill out these applications. So by the time that you're at the end of it, it's like, did I do this correctly? Did I do this right? Is somebody going to call me back? And at least you can leave knowing that you're going to get a call back.
Yep.
Oh man, well listen, you continue to do it from week 1 to week 4 now. Like the artist, the entertainment, the 360 photo booth, like everything just set up for people's comfort. Something they can come in while they get their vaccine, while they get boosted, while they get help with their bills, with their rent, everything. It's set up for convenience to come in like a one-stop shop, and then you can be out.
And you can even
be
get your
healthy.
food.
Most
You can go
definitely.
downstairs to Soulfully Famous with the food.
it's crazy the amount of support that has garnished because of this festival. PA Unites Against COVID, helped us out with a grant for this festival. Shout out to Steinman Foundation because they gave us some money to be able to put out this festival as well. And it's just nice to see the support of health equity in general. We all got to meet at a common place. We all have to live with our health and be comfortable with our health. And with Lancaster lacking a public health department, we want to try to be the trusted source of information for our health, especially among our BIPOC community.
And that's really interesting that you said that, because I know when I first moved here, I remember there was not even a public, but there was a health clinic. There was the health clinic, and it was Southeast Lancaster Health Services. And they were had little satellites, and that was it. And me being from a larger city, we have, I can at least think of 35 health centers off the top of my head, right? And so I'm just well, there's only, really at that point there was the main one on the Southeast, and then there was a satellite in Brightside, and that was it.
Yeah, I mean, if we look at data, different data from different, resources, CDC and whatnot, we all know, not just from living here, but everybody else can see from that data that our marginalized communities are in the southwest portion of the city. So if those are the people that are hurting the most, why aren't we coming together to make sure that they get the equitable support that they need? And that's what we're trying to do here. We appreciate TCP coming down to bring out the word, to show everybody
definitely.
that, we can do this. We can fight against this pandemic and still have a good time amongst people we love.
That's right. Thank you, Sammy. We appreciate you. We appreciate you. Patients are waiting.
Yes.
This whole thing,
Thank you.
is
When you said
great.
this whole thing, I wanted to just a lot of big people energy behind it. This whole thing.
Whole wide world.
Yeah.
Yes, no, it's definitely something to celebrate in the accomplishment. It just seems like it's getting better and better each week.
So can you give us a preview for the next 2 weeks? Can you give us some?
All right, so next week we're going to be having Swim Good headlining.
Oh.
Swim Good is going to be, I'm so excited. Their vibe
excited.
is so dope.
Yeah.
And then, of course, last week we're going to be finishing it off with Sir Dominique Jordan.
Okay.
All right.
Awesome. You know what? And that's kind of full circle because he kind of was a feature with Terry and Mac, who was the artist for the,
Yeah, he was definitely featured with Terry and Mac. Shout out to Terry and Mac, who was our first headliner, and, you're right, it is full circle. And I feel like we have so many moments lately where things have come around full circle. I mean, look where we were just last year, even the year before that, to look to where we are now. Things have come in full circle, and I'm so blessed to have people that I've seen last year on the front lines still here doing this work. So thank you.
Yes, awesome.
Well, thank you, Sam, for sitting down and talking with us.
Anytime. I'm always
man.
down for this.
All right, listen, as we continue to go on with this, we're going to go around and take a look at some of the things going on. We got the band set up on stage. All right, the band's, we have they're set up ready to go. They had sound checks earlier. You'll hear the music in the background. Maybe we can get them back for an interview. So stay tuned. We have a lot going on. We got Cap down here. They're getting you set up with your rent pay, if you're behind on your rent, behind on your light bill.
Right, Live, if you need SNAP or anything like that. Any access to any of that COVID relief money for utilities
All right, we got the
or
360
rent.
photo booth that we're on right now. Yes, the 360 photo booth. Come on down, get in there if you haven't. It's a great experience. We got Cap here. Look. They continue to come out. This is their 4th week out themselves. All right, they're down here to help. We got Boost Mobile. Bring your kid's report card, pull it up on your phone, and then you get a free tablet.
Right.
All right, we also got, look at our lovely black lady doctors right here administering the vaccines and the boosters. And don't forget, we have makeup and
Makeup and magic.
Makeup and magic with Melody,
Magic.
my uni buddy.
She
Let's
got a lot
go.
of M's. Makeup magic with Melody.
Well, I'm just gonna say, I'm just gonna say, I'm not even gonna say all the M's no more. I'm just gonna say,
Oh, and look, did you see we got a celebrity in the
yeah,
building?
we got Janet Diaz in the building.
Yes,
Let's go.
City
She's running for office.
Councilwoman Janet Diaz. Yes.
Yeah, we got a lot going on down here at Crispus
Yes.
Attucks. Come on down, come enjoy yourselves. And plus, you get to hang out with us. Soulfully Famous is downstairs with her food.
Yeah, we can't show you that because that's for us.
The
But,
lady L's hungry too. I ain't even like
look,
she's
I
hungry.
don't know what happens to me. I am always hungry when I get here, but And you know what? It doesn't help that it looks like the Southeast, the next Southeast edition. It looked like it had a candy cane on it. So I was just all the way getting hungry, right? So listen, guys, they have another edition of the Southeast Times out and available.
Yes.
You can actually pick up a copy here tonight or any Friday that we are here. We have the latest edition of the Southeast Times. Written by Southeasterners, produced here in the Southeast.
Yes, something that really needed to be created. You know, we're talking about Southeast Times here, where it's not only highlighting, but it's also covering those stories in the Southeast. So many times, especially when it comes to Lancaster-based news, especially when talking about the Southeast, it's just so easy to talk about the negative stuff, negative. You know, and what the Southeast Times does, it takes their own voice, and now it's the community telling their own tales. You know, their own stories, empowering themselves. You know, and that's really something that really needed to happen, because I mean, when something else happens in the city, you know, let's say that somebody is from So-We, like, they don't say So-We man, you know what I mean? But when it's somebody from the Southeast, you know, they'll say Southeast Lancaster man, you know, they'll say McCaskey student, you know, trying to tie a negative connotation to it. So
You might have graduated like 10 years
yo,
ago.
straight up.
Listen.
Yep.
Today, I'm a McCaskey graduate, McCaskey alumni.
Right.
That's like using your elementary school as like this King School Elementary
Yo.
alumni.
right. They might as well. What? When they talk about me, E.R. Martin alumni.
You know what he did?
Right.
He was a whole grown man. He did some grown man stuff.
Little People's Preschool alumnus. You know.
Yeah, that's the way it goes. Man.
Right.
You should shoot spit bubbles then. What's wrong with the kid?
So, so one of the advertisements. Can somebody pass me one, please? One of the advertisements. Reap what you sow. This is a 10-week program that is happening at Brightside Opportunity Center, and then on 2/22/2002, Brightside Opportunity Center is having their day of giving. So hoping to have them on the show soon, so that they can talk about those things. And Southeast Times, you know, they got my sister in here.
Oh, Fit Brit.
They got Fit by Brit. She should actually be here in a few minutes.
I watched her on Thursday.
Did her
on
thing.
Did an interview. I seen her.
Did her thing.
She did.
Like you people look like you've interviewed before. It's like an interview. It's like an interview in family. I'm gonna tell you this. I'm gonna turn my family into the Wayans.
Oh, do it. Do it. I can see it now. I can see it.
But yes, as you see, Fit Time Brit, she is telling us about how to get slim thick.
Oh.
How to get slim thick. Yep.
Oh, slim thick. I like
Slim
it.
thick. That's that.
I feel like I'm a slim thick.
Hey, join the band.
Oh, all right,
Join,
we got it.
Join the band. DJ 00, you slim thick with us?
Hey, slim fit. Yeah. I can wear medium or large, depending how fit I want to look. How slim I want to look.
Right. Different degrees of slim thickness.
That's right.
But yes, folks, beginning at 7 o'clock, the band is going to get down, and I cannot wait for that. So until that point, we've been talking about COVID stories the last 4 weeks now. Talking about COVID stories, had different community members come out, talk about their COVID stories and how COVID has really affected them. One thing that we did not talk about is our own story and how COVID has affected us. You know, so Lady L, let's start off with you because you have you have a very unique story when it comes to your mom and COVID and having family members in like one of the hottest spots.
So, well, you know what's crazy is that I can actually still remember before the lockdown happened and talking to my dad, and he was like, yeah, there's people at the docks over at the river. They're about to shut us all down. You better go to the grocery store. You're not going to be able to leave your house. My man just called me from Florida from the National Guard. You know, you better get your stuff. It's going down. They're going to be lockdowns. Like, you know, hurry up. You know, it's coming, right? And I'm like, I'm a little bit scared, you know, because, you know, my dad I respect my elders. So I'm like, okay, what's going on? And then like 3 days later, you know, jobs closed, everybody sent home early, you know, staying at home and stuff. And it was crazy because I remember that day because my last day at work, there was a guest and we were like talking and everything and we hugged. And I remember that it was funny because that same night, me and you were talking and you were like, everybody thought it was cool. People were still hugging until today. And I was like, huh? And I was like having a heart attack because I'm like, oh my goodness, I hugged that stranger. But no, so of course everybody knows I'm a Philly girl. And 3 relatives had COVID. All at different times. My one aunt had COVID and she didn't tell anybody. Nobody knew until my other aunt went to go check in on her because she's like, you're not picking up your phone. What's going on? Let me go over there. And she's a nurse. And she's like, yeah, I think you have COVID. She took her to the hospital. She got admitted, stayed there for about a week, but she was okay. So that was the first COVID. All right. So and so that was scary for a little bit. And that was like at the end of the summer. So that was a little bit scary. And then so from there, I had another aunt have COVID, right? And so I didn't know that she had COVID. By the time I talked to her, she's like, oh yeah, you know, I had it. I'm fine now. She's like, I think I got it because I'm not taking that CMOS. Because she's like in her 70s. And she's like, yeah, she's like, you know, nobody in the house got it, just me, you know, and they all taking that CMOS. So I guess that's why I got it. But I'm all right, you know. So there's that. And then my mother had COVID, and this one here, and it was crazy because this was it had to be around the holiday time because our children were in Philly without us. And so they went to take the kids over to go visit my mom, check in with her and everything like that. And she's like, oh, no, don't come in here. I got COVID.
Surprise.
Right. And that was the thing, right? So early on in this process, nobody was telling anybody that they were having COVID. And now you see people just out here all willing to, yeah, we got COVID today.
Yeah.
You know, it almost used to be like this secret, but now it's kind of like, depending on your age bracket, it could be a badge of honor or just like, tag, I'm it today.
Yeah.
That's So those are my COVID stories. I thank goodness, thank the Lord and the ancestors, I have not been touched by the Cooties 2022, the Cooties Millennium Edition. I have not. So, but yeah, those are my COVID stories. I hope you guys enjoyed them. Let me know in the comments.
To the comment section, those people who have COVID stories, let us know your story. You don't have to tell a whole soliloquy and everything like that if you don't want to, but yeah, type it up and we'll certainly read it. Sarge.
That's right. COVID was different. It kind of shut everything down. Back when it first started, it was my my son's senior year, so he was going into about to graduate. So prom and all that stuff just kind of went away. No graduation. It was different for him. You know, so and then deciding on whether or not everybody was going to get vaccinated, boosted in the house because you know, mixed families, you got mixed parents. Parents have different feelings, and some kids just don't want that noise. Like, well, my other parent says they did their research, and they don't want it, and then they end up sick. You know, so I don't know. COVID's been a fight. It's been up and down. Me personally, I thought it was kind of funny when people decided they weren't going to get vaccinated. People have been getting vaccinated their whole lives.
But that was against their will. Our parents was making us get vaccinated, and now we're adults and we can say no.
Oh yeah, even like with people in the military as well. You know, like you had to get all these vaccinations.
Yeah,
you had smallpox, and now you're gonna say you don't want to get vaccinated. Your body, you're right. Okay, whatever.
That's interesting. That's interesting. Well, guys, listen. We have, if you are a fan of TCP Network, you know this lovely lady right here. It is our guest.
I'm sorry, she is looking breathtaking right now.
Yes.
You can't see everything. It's her eyes. It's her eyes that got me. Like.
Well, it makes sense. She got a mask on, so you know her eyes are pop. She's smizing over here.
Yeah, I tried to step it up a little bit. I said, you know what? I see y'all having these transformations every week. I want in on that. I said, Melody, give me the hookup. So I definitely appreciate it.
Well, you look beautiful, Doc. You look beautiful. So we're in week 4 here, and you guys got a lot going on, right? So you got week 4 for vaccinations, and you just started Pipeline of Dreams.
Exactly.
You finished your last book club meeting, and so you guys just have a lot of stuff going on simultaneously.
Absolutely.
Have you slept? Are you sleeping?
No, I was on call last night. So, you know, I think that one of the things for Patients Are Waiting is just that the work that we're doing is about increasing agency, increasing information, and basically rising to the occasion. We have some really, really cool stuff coming up for next month, for Black History Month, because I meet students all the time that are telling me, you know, they don't know if they can do it. And when you start to dig into Black history in medicine and our contributions, we ain't new to this, we true to this. It's crazy. I'm learning so many things. Like the pioneer of blood mobiles, Black doctor. The maker of the technology to cure cataracts, Black doctor. Like we literally have been doing this for a long time.
It wasn't like the person who did LASIK or something like that was like
so even
Black
before
doctor?
LASIK,
Yeah.
cataract surgery. I mean, there's so many things, and I think that, you know, we can get bogged down into this discussion about vaccinate or not vaccinate. At the end of the day, it is that everyone wants to be able to make good decisions about their life and have control over how they live. And that's what we want. And if you don't have information, if you don't have resources, you don't really have control. And so we're trying to just increase that. Part of having, you know, more control over your life is having, you know, better career prospects. And so we're really trying to increase the amount of Black doctors, Black everything. And so Pipeline Dreams is really a program for high school students who are interested in health careers to get exposure to professionals, get exposure to the career tracks, and like, what do you need to do to get through these steps, and just kind of demystifying the process and helping students connect. So it's really exciting. We have 41 students who are in the program, and we had a great kickoff. You know, the book club is also, we're constantly doing things, and so if there are things that we're doing that somebody wants to partner on, we're down for it. You know, everybody needs support. But at the end of the day, it's about eliminating health disparities. Like, there's no reason why we should have worse outcomes for everything because of the color of your skin. It doesn't make any sense.
It doesn't. But welcome to America. All right. Sarge, do you have any questions for our resident resident doctor?
I got to interview her about what, last week? The week before?
No, that was like first week. I think that was week 1.
No, I always interview her every week.
Oh, okay.
I interview her every week. It's thing. I make sure I do.
I miss being in studio. Like, my schedule has changed, and so it's like, and then they got, you know, everybody got the child care issues, because right now I don't have no child care. If you're a babysitter.
See, that's what I was going to ask you. How was your week? You know, missed you on Thursday. I came in. I was like, is Dr. Hamlin coming? They're like, no.
Yeah. So I was on call. So yesterday, great day, but literally I was on 24. So, but it's really fun to do good patient care. And I did. And now I'm tired. And then it's really fun to come and do great community work. And so I'm so excited about tonight, about, hearing Los Monstruos. And there's been so long since we've been out and doing things. And it may feel weird to be out and doing things with masks, but I feel like, you know what? However we have to do it, that's what's next. Because life that we knew before, like you just said about hugging somebody at work, you're like, when will I do that again? It's so nebulous. You just don't know what it's going to be like. And, we have to continue to live.
Yep.
All right. Well, listen, we have, 2 more weeks of this, right?
Oh, yeah.
I ain't going to hold you. I'm anxious about the spring, too. Like, when the weather breaks and it gets warm.
Oh, yeah. I'm definitely thinking about, what community block parties and different things. And, Brightside's Health Fair will be in February. That's very exciting. This is 2 years that we haven't had it. And, there's so many pillars in this community. And I think that we just have to continue to support each other, because who's going to do it but us?
Nobody.
And it's great to have support from outside. But at the end of the day, when you see consistency, who's showing up, for us, it's us. Mm-hmm. And there's nothing wrong with that, because we can do it.
Yep. Oh man, I love it. Well, Dr. Hamblett, I kind of shared this with Dr. Livingston. Everything that you guys are doing, I wonder if we got some kind of Black global majority medical charter school educational facility situation going on. Maybe 10, 15 years.
I mean, listen, there's a lot of things that already exist. I follow Nicole Jones Hanna.
Okay, yeah.
For the 1619 school, the Black school.
Yeah.
She literally just founded a school.
Yeah, but she's all the way out. And where's that? Iowa or something?
Well, she's teaching at Howard now. And, the things that we talk about, there's people doing these things. And it's I said, why not you? Why not me? Why not us? So, if you got a building that you want to donate, listen, I speak things out into existence, right? Speak it into being. Why not?
I love it. Listen, I can't wait, and I definitely feel like in a couple of years, as we continue to see the increase in diversity in medicine, we can definitely say some of that's attributed to our Black doctors here in Lancaster.
Listen, we have a need, right, in this region. There's needs for everything, right? But even right here, you look at the different health systems, you need nurses, you need x-ray techs, you need doctors, you need surgeons, you need ultrasonographers, so many things that are needed, and these jobs are available and this training is available. Why not let it be us? Stevens Tech is wonderful as well. There's other schools, there's other paths. And so I think that we just have to see them as possible, because again, there's nothing in this world that is new. Everything has been done before, except maybe the metaverse. But, it's these are things that are possible. And we can get them done. We just have to know that it's possible, believe it, and keep working towards it, because you can accomplish them. Right here, we have a student who's from Kutztown. She's a pre-med student, and she's volunteering with us tonight.
Oh, man. And you know what? And I thought she looked a little young. And I love when you guys have your students come in and support and volunteer, because you see the mentorship in motion, right? You see it happening live, and it's not only are you hosting an event, but you're also mentoring simultaneously.
I mean, these are the things that keep us going and keep us energized, because you know that somebody needs you. So the other things that keep us going and energized are a little bit of good music and good vibes and good people.
Yeah.
Knock out. Well, listen, you guys, get on down here to Crispus Attucks. We're down here. We'll be out here till 9 o'clock. Look, music and medicine. All right, that's what I call it. Music and medicine. Come on down. Come feel good. Come get vaccinated. Come get your booster shot.
There's a couple more M's, right? Because you got Makeup and Magic with Melody.
Yes.
And then you can get some monies. You can get some of this COVID relief monies for your utilities and your rent. So if you are still behind on your utilities and your rent from COVID, or if you are still some kind of displaced, come on down here and get you some money.
What are you waiting for? Get on down.
So for any
we're gonna
student in the
continue to
school
rock
district of
out.
Lancaster,
Thank you, Dr. Hamlin, for sitting down with us. Got anything you want to put out?
yeah, just saying about Boost Mobile is here.
Yep.
Any student in the school district of Lancaster can get a tablet for free, and they will sign you up and give you your tablet, hand it to you here. So there's lots of things, and we're just really trying to corral services and connect people to the things that are available for us.
Yep. Oh my goodness.
All
Oh,
right,
man.
all right. Well, thank
All
you,
right.
Dr. H. We're going to keep this thing rolling.
All right. So we're going to keep this thing going. Thank you so much, Dr. Hamblin, for joining us and just sharing with us and making time. So, guys, we're going to keep this thing going. Don't forget, we are here until 9 o'clock at Crispus Attucks Community Center. Come on down, get your flu shot, get your vaccination shot. Hey, listen, if you got your first dose with us during week 1 of the Health Equity Music Festival, if you were here and you got your first dose during week 1, it's time to come back this week. You should be back here tonight getting your second dose. So come on down to Crispus Attucks. If you were here week 1, come back tonight so that you can get your second dose, and then you'll be all vaxxed up. And you're good to go. You're good for that flight. So listen, we got another guest. We were saying this. We were like, oh, we got a celebrity in the building tonight. So we got City Councilwoman Mrs. Janet Diaz. Woo, woo, woo.
Hey, how are you, everybody?
Yes.
So we're out here at Crispus Attucks. You have the opportunity to come out and get your vaccine. Nobody's going to bite. Just a little tiny little pinch in the arm and you'll be ready to go.
Right.
There's music here and we'll be happy to dance with you.
That's
How
right.
about that?
Yeah.
Listen,
And they even have vaccinations for children, too.
Yes, we can bring your children and they'll be happy to listen to some salsa.
Yes.
Listen, come on down. Look, if you have your report card, if you can pull it up on your phone, come on down, talk to booth. You'll get your kid a free tablet. All right?
I'm going to say this a little bit in a different language.
Do it.
Aquellos que están en la comunidad que necesitan el COVID vaccine, vacuna, por favor salgan para que puedan vacunarse. Es gratis, no tiene que preocuparse. Y tenemos aquí una orquesta, los monstruos que van a tocar, puede bailar y gozarte. Ven esta noche, hasta las 9 estamos abiertos.
All right.
Thank
Thank
you.
you.
We appreciate
Thank
you. Look,
Thank you very
so
much.
How's COVID affected you over this time? I just want to, how's COVID affected you over, since it began?
Well, working at LGH, we had 500 people in one day. 261 were actually inpatients, and then the ER was just overloaded, so it affected us very much. Our nurses are just completely overly exhausted because of the extended hours. We had lost a lot of nurses because COVID, they didn't want to actually get their vaccines, so they left. And some of them was because they were totally exhausted from, overtime. And we have a complete shortage. By the way, if you're interested in applying to LGH, we are looking for nurses and for nurses' aides. Come on out. It will be an opportunity for you to make some good money and also help our community, the patients. That's what's important.
That's really interesting because I know maybe about a decade ago, healthcare and nursing was determined to be one of the fastest growing industries. One of the fastest growing industries, and it's almost like the pandemic came and obliterated it.
It literally wiped out a lot of our nurses, and it's not just in Lancaster, it's all across Pennsylvania and all across the nation. But if you do sign up, you have an opportunity to start nursing school. Even if you're coming as a CNA or a unit clerk, you can start there, and within a year, you'll get your tuition pay up to 80%. Great benefits. It's time, especially women of color. I can tell you right now that working in neurology, we got our first woman African-American neurologist director, and I was so excited.
Wow.
Dr. Cross is awesome. So that gives you the encouragement that whether you're African-American, Latino, or Asian, you can grow in a hospital as well and become a doctor or nurse. Take that opportunity, especially now.
I love that. That is awesome.
Well, listen, is there anything you want to put out there to the crowd, to your constituents,
Well, I really would like everyone to know that if you're sick, stay quarantined, wash your hands, wear your mask. There are boosters out there. You can go to different locations. I think LGH has a station. Come on out. We don't want you to be sick, and we definitely do not want you to die. We want you to be healthy because we care about you. I care about you.
Oh, man. Well, thank you, City Councilwoman Diaz. We appreciate you. We love
Thank you for
coming
joining
in,
us.
stopping
Thank
by.
you.
Stopping
Have a
by.
good evening.
Yes, you have a good evening as well. Thank you. Well, you guys, look,
All
we're going to
right,
get ready to turn to the music right now. It's been another great time.
no,
the band's getting
no.
up there.
We're gonna we're gonna just show them what's going on down here before we do all of that. So let's check in and see what's going on around the gym. All right, guys. So we're here at the Crispus Attucks
You
Community
got Double
Center.
O looking good. You see him. Look, this is what's going on behind the scenes. You got the
Yes.
band up there. They're getting ready to go in. So get down here. Bring your dancing shoes. All right, show us what you got. Show you can get down just a little bit. Just a little bit.
I love all the live instruments and everything, and then the 360 photo booth.
Yes, jump in there with your date, your kids. So your cousin and them.
Right, and then we have Kappas here. They actually have also information on Thrive by 5, so just giving resources on how to help your little one who is under the age of 5 years old. And then we got Boost Mobile here. So listen, if you have a student that goes to the school district of Lancaster, or if you receive medical assistance, or if you receive food stamps or SNAP, you actually qualify for a free tablet. So you can come on down here, get a free tablet, 35 gigs a month, and you can also get your flu shot,
look at our
your
black lady
vaccination
doctor.
shot. Yes. Come on down here to support our
Yes,
Yes.
look,
See
City
Janet
Councilwoman
Diaz,
Diaz.
yeah.
She can't stay still. She can't stay still. Get it. And don't forget we got.
makeup and magic with
Make-
Melody De Leon.
Look at her getting it. Yes. Look, I don't even look at her out there
So-
doing work.
And you know what's crazy
Go
is
ahead.
that actually when you come down and get either a vaccination or a flu shot, you are entered to win a free makeup makeover with Makeup and Magic.
Yes, I'm saving mine until the end. Save the best for last is what I like to say.
Oh, really? Saving the best for last?
That's what I like to say.
So,
But-
yeah, guys, listen, come on, get on down here and get your vaccination or flu shot, or get some access to these monies, this funding for your utilities. But I am so excited. I cannot wait to hear the band. And you
Yes.
know what else I want to know about?
What's that?
What's going on with the food? Where
Oh, man.
is Soulfully? I don't have a menu for you guys
She's
just
downstairs. I think she has
But-
that honey chicken tonight.
yet.
Hopefully that
man.
honey chicken tonight, because I know I want some of it.
Oh man, I just
I'm always hungry for some honey chicken. And so whatever.
yeah.
Yes,
Yep.
yes.
So we are switching over.
So
Yep.
we're gonna keep going as they go.
Yep. So they are getting ready to go.
guys, this is what we do.
live.
All right, this is what we do. As the band gets ready to start, we're gonna keep going on, keep talking.
Yeah. So actually, the band is actually setting up, getting ready to go live. So if you were hoping to see them performing, come on down here to Crispus Attucks Community Center. They're going to be playing. You've heard the music in the background, so they're actually about to start with some salsa. I heard them say.
Yes.
So you might as well come on, get down here.
So don't be scared to get up and dance, because you know we're gonna go on. I might get up and go a little bit myself. I like the slow beat, start off slow, you know? I like to know that I still got the juice. Because when you still got the juice, that's when you go and you do it all. You give it your best.
Oh,
And I can't wait to see some people out there dancing tonight. You know?
Oh, okay.
All right.
So, listen, guys, we actually got a Zoom interview that we're going to share with you guys. So we're going to go on ahead and cut to that. Stay tuned. It's TCP in the morning, and we are here at Week 4 Health Equity Now Music Festival.
Hey.
All right, guys. So, so the band is up and going live. They're starting with a classic. Yeah.
Yeah, you gotta get down here. They're going.
I love it. Listen, I want to move.
Hello.
Yeah.
Hello.
I know y'all moving. You're moving them shoulders over the screen. I see you. So you might as well come on down here and enjoy the vibe, right? So listen, even if you are vaccinated, maybe you've been like, oh,
All right, we're gonna get to that Zoom interview.
All
Take
right.
a look.
See you on the other side.
Dr. Martin, what is the latest and greatest out here in these COVID streets?
So we have finally some good news. Some of the COVID cases are decreasing. Last week we had a pretty big fall in the actual number of cases, and it's something that we've been seeing from the counties east of us, so Philadelphia, Delaware County, and they had been decreasing a couple weeks ago, 3 weeks ago, and now we're starting to see it here in Lancaster County, which is great. However, we still seem to have a fair amount of hospitalizations. Those always take a little bit longer, usually 2 to 3 weeks after cases go down to start to resolve. But there is some optimism and some hope.
Well, that's great. I'm glad you have it, because sometimes I don't.
Yeah. Well, it's been hard to be hopeful. We've been obviously wrong in the past, but the decrease that we had last week was pretty significant here in Lancaster County, and it doesn't mean that we can go about our regular business. We still have to do all the things that we know protect us from COVID. And the other, I think, optimistic piece that we're getting more and more information about is that if you get boosted, so if you were fully vaccinated and then got your booster shot after that, that really does decrease your risk significantly, not only of getting Omicron, but certainly of being really sick with it and having to be in the hospital.
Gotcha. So I wanted to ask you, right now, some of the things that I'm feeling out in a community is like, if you do a home test, do you need to have a confirmation with a PCR test? So what's kind of the testing strategy that we're working with right now?
Yeah, so we used to not be terribly excited about these home tests because they were initially not as accurate. But what we're finding now is that because there's so much COVID around, it actually makes the test more accurate if it's positive. So if you have a positive home test that you do, a test you got at CVS or Rite Aid, and it's positive, you can basically say, yes, I have COVID, and you don't need to back that up with a PCR swab. However, if you're symptomatic and you have an at-home COVID test that is negative, that really should be backed up with a PCR, because in that instance, it's likely a false negative.
All right. So if you have symptoms, you should test. And you can test with a home test. You don't have to go to the emergency room, urgent care, or your doctor's office to test. You can be confident in a home test if you have symptoms like sore throat, stuffy nose, fevers, chills, etc., loss of taste or loss of sense of taste or smell.
Yeah.
And so if you have symptoms, test. You can get a home test from CVS or your local pharmacy, and those tests are running about $25. I know that Union Community Care had some tests that they were distributing. Do you have any leads on where you can get free tests?
Yeah, so the government has now put up a website where you can order for free tests to every single house or apartment, and it will be delivered through the mail. I've already signed up for this. Obviously, there's going to be a little bit of a lag in time frame to get those tests put out there, but that is definitely a place where you can get 4 free tests delivered to your home.
Wonderful. So if you want to have tests on hand, you need to go on the site before you have symptoms. Because you're talking about 7 to 10 days. Right. So really, it's good at this point in the pandemic to have tests on site at home, just in case. So if somebody in your household becomes ill, you can test at home without having to go to seek medical attention. So we want to go ahead and order your tests for your household from the US website, and then have those tests on hand for if somebody develops symptoms to go ahead and get tested. Doing a home test is reliable and accurate, especially in the case of a positive result. You don't need to confirm it. But if you're symptomatic and you test negative with a home test, you may then seek medical attention, whether with your doctor, with your the community testing site, or with an urgent care if you're having trouble with breathing, or the emergency room if you are really in dire straits. Specifically, meaning if you're having trouble breathing, going to the emergency room because nowhere else is open for a test, it's not the best use of your resources and time or our health systems.
Yeah. And it's interesting right now. that when we look at our symptomatic, so people that have cold symptoms like a sore throat or runny nose, when we test them with the PCR swab, 50% of those people are coming back positive for COVID. So it basically means if you have any sort of cold symptoms, cough, runny nose, congestion, sore throat, fever, right now you have a 1 in 2 chance of that being COVID. So
Wow.
that's the importance, I think, of why you need to get these rapid at-home tests, and you need to isolate at home before, after you test, to make sure that you're not going to spread it to others.
Wow. That's definitely a huge difference. I think that before, our index of suspicion or the likelihood of certain symptoms being how much we thought something was COVID, there were much more severe symptoms.
Yes.
Now so that's, I think, another thing that's reassuring, but at the same time, you don't know whether the people that you're around are at significant risk or at, low risk. So again, the point of continuing to protect ourselves with vaccination, and that's one of the things that we know is going to cause a significant decrease in the severity of illness and the chance of hospitalization if you do contract COVID.
Yeah, absolutely.
Awesome. So now what about if a person doesn't have symptoms? When should you be testing if you're exposed?
Well, so the recommendation is if you've had an exposure to someone who is known COVID positive, that you should test if you have symptoms. And if you don't have symptoms, it's not a bad idea to test about 5 days after exposure. And that's an attempt to try to pick up folks who have COVID but don't have symptoms but can still spread it. And generally for that test, we recommend that it's a PCR swab because it is a little more accurate in somebody without symptoms. So your provider will be able to give that information to people who've had an exposure in the home and should be able to order that swab for you.
Okay, so we got to back up. So if I get a call that says, hey, I know we were out to dinner last night, I just tested positive for COVID. Now I should, 1, isolate. 2,
it would be quarantine. Yeah.
Quarantine.
You would quarantine.
So I'll quarantine. I'm going to stay home and not be around people and waiting to see if I develop symptoms, and then test on day 5, whether I develop symptoms or not.
Correct. If you develop symptoms within that day 5 period, just test yourself. And, you can use the home test for that. And if it's positive, then, you have it, and then you need to be in isolation, which is a little different than quarantine because you have the positive COVID test for at least 5 days.
Okay. So now what makes an exposure? Because I think, we have changed, right? The guidance has changed around, with an exposure, managing it differently if you have been vaccinated or not. And so it sounds like now the guidance is the same whether you're vaccinated or not.
Well, no. So if you're fully vaccinated and you've had your booster, if you're eligible for it, so there's some younger kids that can be fully vaccinated, but they're not yet due for their booster. They're considered fully vaccinated and boosted. If you've had all the shots that you can get, including the booster, you don't have to go into quarantine, but it is still important to wear a mask consistently for 10 days and to make sure that if you develop any symptoms, to get tested.
Okay, so I'm back to my example. I was out to dinner and obviously we were eating, so we weren't with masks on. And the person I'm out to dinner with calls and says, hey, I just tested positive for COVID. I'm vaccinated. I am now going to quarantine at home and test if I develop symptoms, or test on day 5 whether I develop symptoms or not. In the meantime, I'm also going to wear a mask.
Right. But if you're fully vaccinated and boosted, you don't necessarily need to begin an at-home quarantine. The quarantine is you wearing your mask in all public spaces and at home as well. So if you're fully vaccinated and boosted, you don't have to stay at home for that first 5 days. It's only people who are not fully vaccinated and not fully boosted need to remain at home for 5 days.
Okay. Now, so if I'm exposed, I'm wearing a mask,
If I'm vaccinated, I'm wearing a mask everywhere I am. And if I am not vaccinated, I am staying home.
That's right. Got it.
Okay. All right. So if I'm not vaccinated, I got a 5-day timeout.
Yes. And that may not be long enough, but 5 days sounds like a good timeout for me right now.
All right. All right. So we've talked about if you're exposed, how you should manage that. When should you test? And then let's talk a little bit about any kind of treatments. I know that early on, we really didn't have anything much. We've heard things in the news and on social media, but what treatments are available? If I do get COVID, am I just sitting at home and hoping that I don't die? Or is there what's available to me?
Yeah, so there's a lot of great stuff. Unfortunately, we're still not having a lot of the new tablets and the new antibodies come into our community, but it's going to get better week to week. So there are some antiviral medications like Tamiflu that we, sometimes take for influenza, and it works the same way. If you get symptoms and you get tested, then you can start this medicine within 5 days of having symptoms.